Reporting today exclusively for WBBA-TV here at Life Science Innovation Northwest. And it is my privilege to introduce the CEO of Cardiac Insight, Brad Harlow.
Thanks much. Good to be here.
Brad, I had the chance to interview a friend of yours earlier today, Dr. Tom Clement, and I understand that you have some shared history there.
We do. Tom is on the board of Cardiac Insight, my company. We are together on the board of Wings, where he's a co-chairman, and we have done a number of startups and fundings together. He's a icon in the Seattle community.
Would he say the same of you?
I hope so.
Okay.
I hope so.
Let's go with that.
Let's go with that.
So I'm having the chance to interview the iconic Brad Harlow, and I understand that Tom, for a spell, held your title at Cardiac Insight.
He did. When I founded the company, I bought this technology from the University of Washington with its founder, Dr. David Linker. And at that point, we needed a president. And Tom was the first name that came to mind. And one of the other investors, Kirby Kramer, and I both said, let's make Tom president. So Tom did a great job, got us through our first 510K before we did our full funding, and then brought in a new president from a former competitor, and then I continued to take the helm as CEO.
Okay. So tell me a little bit about what your technology is.
So
and I think you brought some show and tell.
I did. Everybody loves show and tell. So think of it as a Band-Aid that does 7 days of ECG. So it records your ECG for 7 days. You put it on your chest, like that. You can shower with it, you can run with it, you can work out with it. It records every beat of your heart, beat to beat, and then it analyzes it so that when you bring it back to your physician, they can immediately print out a report of all of your morphologies, or if you will, all of your cardiac events. And he or she can say to you, do you or do you not have certain anomalies, atrial fibrillation, fast, slow heart rates, pauses. It's a great way to find out how your heart health is from an electrical standpoint. Reimbursed, it's a disposable product. The current generation of products that are out there prior to this take a great deal of technician involvement. They're expensive, they're cumbersome. So we really aim to try to change that by making something that was small, light, very inexpensive. And Tom started us on that way, and we're continuing.
So the current technology, if I'm not mistaken, is a Holter monitor?
That's right. The current technology is a Holter technology. There are some body-worn devices that are out there that are larger, but this is, if you will, a 7-day Holter in a body-worn format, or a what's called a stick-on format.
Tell me, how does if you don't mind showing the
Sure.
device again, how does the information get to someplace useful?
Absolutely. So when you come back to your physician, he or she plugs in a little micro USB to the side, and it immediately prints the report. The analysis is actually done on the unit, inside the chip, so that it can be done at a rural clinic, it can be done at a remote clinic, it even can be done in a third world country. You don't need analysis software, you just need a PC to be able to print it off. So again, this was made not only for the cardiologist and electrophysiologist, but a primary care physician. So our investors, who primarily had been individuals, are now 2 large strategics that will be announced in the next 2 weeks, one of whom is going to brand it their own and put it out worldwide.
Look at you, all right. I know we can't ask for the scoop. Now, you're showing me the front. I'm not seeing where the USB would go.
The USB breaks open. There's a breakup path.
Can you?
I can't on this one because this is a working FDA device, and they'll get mad at me.
Oh, don't do that.
Because once you break it, the device can't be used again.
Well, once you break it, you buy it.
Exactly.
And I don't
you don't have the money.
I don't know how much money it costs.
Doggone it. If he had cash, we would have done this. But there's a little micro USB right here, and it plugs right when you break it or cut it with a pair of scissors. It's right there to plug in. On the back are the electrodes that stick on the patient. So, if you will, it's sticky, but you can put it on and off. So it holds, but you can take it off and put it on again. So that way, if for some reason it came off, you can reapply it. But again, you can use it when you're showering, you can use it when you're working out, obviously sleeping and going through your day. About 25 million patients a year are applicable to this that come in with transient symptoms to their doctors. So it's already something that is well defined. That is, how is my heart health from an electrical standpoint?
This sounds disruptive, and with disruption comes resistance.
Agreed. And part of that disruption is what is currently done. Currently, devices are used and then sent to scanning centers where the report is formatted and completed and sent back to the doctor. This cuts that out of the loop, so it's a little faster. But in terms of what the report looks like at the end, it's exactly the same. And from a physician standpoint, it's faster. They get the immediacy of when a patient comes back after 7 days, they can immediately print that report and let the patient know what the prognosis is or what they have to do next, whether they would be escalated on for potentially a pacemaker or an implant, have antiarrhythmic drugs, or nothing. Reassure them that everything's fine. So while disruptive, it's a limited disruption. We're very happy about that.
Okay, so this is our first time meeting,
It is.
and although we have a number of colleagues in common, I haven't had a chance to see the prototype before.
Okay.
Help me understand, so the Holter monitor community,
Yes.
it's entrenched, it's been around for a long time. You are a direct threat, a one-to-one potentially for
We are.
that business. So what kind of resistance do you anticipate, and what strategic plans do you have to overcome what could be a slow adoption curve?
Those are great questions. The reality is, if we were going on our own with just the Cardiac Insight brand name, we would look for early adoption, we'd look for cardiologists and electrophysiologists, we'd build white papers and support, because even after you get your FDA approval for sale, it takes a long time to get market traction. In this case, however, one of our strategic investors is a well-known name in the cardiology primary care marketplace, and they will brand it their own. So therefore, you sort of have an inbound acceptance to the physician community that this is past muster with them. But even with that, adoption will be slow, but even slow at a small amount is huge numbers of these devices. Tens of thousands of these devices can be used because a physician might see 1 to 2 patients a day that are applicable in their practice to this. So once a physician starts using it, it becomes a consumable product that they continue to buy over and over again. So again, the support for the product grows over time, and once you have an account, they continue to purchase. But I do think it will take time. We have no illusions, although having a large strategic putting their name on it will be a very pleasant way to go out.
Will they be the exclusive brand for this device, or
They
might
will.
you white label it and give it to others as well?
No, they'll be the exclusive brand for this device, and it took our board quite a bit of time and thought, but we feel they are such a large multinational company that it made sense, and they're making an equity investment in addition to this commercial agreement, so we're very pleased.
Okay. Tell me, do you have, I don't know where the technology was, you mentioned where the technology was born.
Came from the University of Washington. It was developed by a cardiologist there named Dr. David Linker, who actually, not only being a cardiologist, he's a biomedical engineer. So he filed the early patents as well as wrote the software code for the device.
Okay. And undoubtedly you have this well patented and protected. Do you fear any competitive response of any kind, whether it be an innovation or trying to protect what's already out there?
Cardiology products, and I've been in this business for over 30 years, both on the ultrasound side as well as on the medical product side, is filled with innovators. And there's room for any number of them. There's less issue related to the patents and more related to getting share of mind and getting users to be accustomed to using your product. I think that's what you have to overcome. I'm not concerned on the patents. We have very early and strong and deep patent protection. I'm more concerned that we do a good job rolling it out and a great job with our early customers so that they're comfortable with it.
When the concept was it born from the perceived need to replace older Holter technology?
It was. So what happened was Dr. Linker in his practice found that many patients couldn't tolerate a long-term monitoring situation, and they stopped monitoring. So he actually sought to solve that problem with a very small and very light. This weighs less than 9 grams, about what 2 quarters cost, or in terms of weight. So he really tried to take care of the patient issues. So again, it was innovative, but it was iterative on what was already out there.
Is your company a one-product company? Do you aspire to make other products to help the cardiology community?
We would aspire to be broader than cardiology. We see ourselves in the body-worn technology area with cardiology as our first offering, and after that moving into some of the other specialty areas.
Fair enough. Is there anything you'd like our international audience to learn in general about the company, the device, and how how they can participate in what sounds to be a pretty sure path of exciting growth for you and your company.
We hope to, and I would like to have product out by the first quarter of next year, and we'd be interested in medical centers and or institutions that we're interested in being first users, both from a publishing standpoint as well as from a practical clinical standpoint.
What's the best way for them to get in touch with you?
I think directly to the company on the website or via email, and both are accessible.
Would you tell us what that website is?
www.cardiacinsightinc.com. That's the simplest way.
Thank you very much.
Thank you.
This is Joe Hage. I lead the Medical Devices Group on LinkedIn. I'm pleased to have had the chance to get to know you. Brad Harlow, CEO of Cardiac Insights. Thank you very much.
Thank you, Joe.